You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, big topic, Mommy Makeovers. Very popular procedure. With us, we have a board-certified plastic surgeon in Newport Beach, Dr. Tenley Lawton. Dr. Lawton, welcome to the program.
Thank you.
Now, before we get into today's topic, for people that don't know you, tell me a little bit about your practice, who the typical patient is, and what are the different procedures that you do?
The good thing about my practice is I have a full range of plastic surgery. I do simple things like injections and then full mommy makeovers, breast reconstruction, so I do some reconstruction as well. My patients are anywhere between maybe 20 and 70 years old, so I have the facelift patients and then the young patients who are just getting into the plastic surgery realm with either breast augmentation or maybe some Botox.
Okay, this term mommy makeover.
Yeah.
Do they actually call it a mommy makeover, or is that just something in the media or in advertising?
No, they actually do call it. I think it's something that media probably created because these procedures have been around for a long time. But
okay.
Mommies are calling and asking for a mommy makeover. They say it's time for me.
What defines it?
Any procedure that's done on a mommy. So it can be a combination of procedures. It could be Botox and a breast augmentation, or it could be a breast augmentation and lift, maybe with some liposuction or a tummy tuck.
Okay, good. Your background and training?
I'm from Michigan. Did all my training in Michigan. So I went to undergrad at Central Michigan University. Then I went to medical school at Wayne State in Detroit, and then continued on my plastic surgery training in Detroit as well. Okay.
And how long have you been in Newport Beach? You look very young, by the way. I know your age. You're about 10 years younger than, I mean, you look 10 years younger than you really are.
Oh, good. Thank you. I've been practicing for 8 years.
8 years?
Yes.
And do people ever make comments about that when you first started?
All the time.
What do they say?
Are you old enough to do this?
Is that right?
They do. And they occasionally still do, because if I come in after surgery and I have my hair in a ponytail and in scrubs, I tend to even look younger. So I sometimes have to warn people. Yes, I'm a little older than you think I am.
Now, so with mommy makeover, so who is the typical mommy makeover patient? Like, what are their ages? What are their goals? What are they telling you?
At least where I'm at, they're anywhere from their late 20s to mid 30s. Occasionally some people wait into their 40s and 50s to do this as well, but for the most part I would say women in their 30s.
Okay.
So women have had a couple of kids, they usually are done having their children, and they just want to get back what they used to have.
Now, when you're doing the consult,
right,
they come in, do they bring their spouse or partner oftentimes, or no?
Most of the time they come in by themselves.
Okay, and what, now when you look at them, do you see the end result in mind?
I do. You know, once I've looked at them, I can tell the different procedures that are going to make them look and feel as good as they feel.
What's that consult like? Take me through that.
I usually ask the patients what they're there for first. I don't want to give them my opinion without knowing what they're there for. So if they're there for their breast, I'm not going to comment on their tummy. But most women, I would say almost 90% of the women will focus on their breast, because that's one of the things that changes a lot after just the act of pregnancy and then breastfeeding as well. So they want their breasts lifted back to where it used to be before pregnancy. A lot of women like what their breasts looked like when they were breastfeeding. They want that full look. And sometimes you can achieve that with an implant alone. Sometimes they actually need a lift procedure to get that look. Okay,
now the tummy area.
Yes.
When does it need to be a tummy tuck, and when could just liposuction do the job?
If it's just a little extra fat, then you can do liposuction. But once the tummy has been stretched beyond the skin's ability to contract, then liposuction won't work. There's muscles, obviously, that run in the front of the abdomen here, and there's a piece of tissue in between called a fascia. That fascia is not elastic, so if you stretch that out, the muscles can't pull it back together again, and women get this sort of bulge to the look in their abdomen, and they don't like it. So if you've stretched the muscle and the skin beyond capacity, it's a tummy tuck.
Now, stretch marks, you're able to get rid of stretch marks?
If you do a tummy tuck, you can get rid of stretch marks. There's no cure for stretch marks besides cutting them out. So a tummy tuck will alleviate usually the stretch marks from the belly button down.
Okay, now when women do this, how soon should they wait after pregnancy to do something like this? Like a tummy tuck, breast lift, things like that?
I usually tell women it takes 9 months to get the body to be ready for pregnancy. So you got to give it at least 9 to 12 months to get back to your pre-pregnancy shape, or whatever it is that you're going to maintain after that. After 9 months to a year, you're probably at your final result, unless you have more weight to lose.
Okay, now what about scarring and things like that, downtime?
Scarring, we all plastic surgeons keep scarring in mind with every surgical procedure we do. We're going to hide it in a good place. A scar from a tummy tuck is usually from hip to hip, but it's within a bikini line. So if somebody wanted to wear a bikini, then you're still going to be able to do that. On the breast, you know, typically it's in the crease of the breast, so that when you're in a bikini, you won't see that as well. Obviously, when you don't have clothing on, you'll see the scars, but they all fade.
Okay. Now, with the Mommy Makeover, when it's all said and done,
yeah.
Big boost to the self-esteem.
Huge boost.
What do some of the patients say? Most
women, I think one of the things that people don't understand is that, yeah, we see the outward effects that pregnancy have on women, but we don't see the inner aspects of that. Psychologically, women are really sort of different after they have kids. They feel good, but then they look in the mirror and they don't feel like they used to look, so their self-esteem goes down a little bit. They're trying to gain that back, and you know, if you don't have to go overboard. You're just enhancing their natural beauty, and then women get a huge self-esteem boost from that.
Okay, now, you know, we were talking in our green room over there, and I think you were interviewed one time or on the news, and they asked you, but isn't it a waste of money to do this before a wedding and things like that? And
I totally disagree. You know, psychological reasons, if somebody can get their body back so that they're feeling sexy and feeling like they look good, psychologically they get a lot from that. It's not all about the money. You know, I completely disagree.
Do women want a female plastic surgeon?
Absolutely.
It seems like they would.
They do. I know what they've been through. I can completely relate to the changes that they've gone through pregnancy and breastfeeding and all that they give to their family.
I mean, you have 2 children.
I have 2, yeah. So I know firsthand what it does. And so I think women have an easier time relating to me, and so then they can talk to me openly and not feel like they're ashamed at all.
You know, I posted that I was going to have you on my show today on Facebook. And I had some private messages. They're saying, oh, you know, tell me about her. What's she like? You know, I've been looking for a female plastic surgeon. And I didn't realize, I guess, are they hard to find?
There's just not that many board-certified female plastic surgeons in the area. It's not that there's none, but it's a lot less. And so I think I have a unique audience, you know, that women search out female plastic surgeons.
Did they say that to you? Did they come in the consult and say, I was looking for a female plastic surgeon?
Yeah, they do. You know, and I think it makes a big deal for women's confidence, where if they feel like they're able to share everything with you, they're already forming a relationship with you before you even have surgery. And you know, if they tell me everything that they want, I can address those needs.
Are there women, okay, so let's say, I mean, you're in Newport Beach and the surrounding Orange County area, are there a lot of women that want to do it, but they're afraid to do it? And what are their fears?
I think there's a lot of women who are afraid. First of all, mommies tend to feel guilty anyway. You know, they're going to be taking time away from their family for recovery, financially. And so they feel guilty. And I think once they get over that and say, you know what, it's time for me to do something for myself, once they get over that guilt, then they'll search out the procedure. If they know people who've had it, then maybe they're like, oh, well, they're doing it too. I don't feel so guilty. You know, this is something I can give back to my family because I'm going to feel better about myself.
Why in this economy would a woman want to do it?
I think some people, it's to get back into the workforce. You know, they want to feel better about themselves. They're competing with other younger women, or they just want to feel more confident. And I think when you're back out in the workforce feeling more confident, you're probably going to get the job over somebody who's less confident. Or they want, you know, to basically just boost their self-esteem, I think.
So Mommy Makeover, so breast, tummy tuck in many cases, a little bit of liposuction combination.
Sometimes all 3.
And can you do it all in one day? I mean, you do it all together.
If somebody's young and healthy, you can do it all in one day. You know, it has to be reasonable, the amount of hours you have somebody under anesthesia, but for the most part, you can do these procedures on a young, healthy person all in one sitting.
So what is the downtime? So, okay, so somebody gets a lift, they get a tummy tuck, maybe some liposuction. When can they go back to work? And what's that like, the downtime?
You know, most people are going to need to be off work at least 2 weeks. You know, it's a gradual recovery period. The first week is obviously harder than the second week, but I don't want people going back to activity too soon. So usually about 2 weeks, but they're not going to be fully back to feeling great working out till probably 4 to 6 weeks. Okay.
Now with, as far as, what should somebody look for then? I mean, we're almost out of time, but what should somebody look for in a surgeon that's doing a mommy makeover?
Obviously, everybody knows you should pick a board-certified plastic surgeon. Other than that, I think you need to find somebody who's trying to enhance your natural beauty, somebody who has attention to detail.
Okay.
And I obviously think you should pick a woman because I've been there. I know
pick a woman.
I know what you've been through.
Good for you. Do you think you have an eye for it?
I know I have an eye for it.
You know, we said, you know, Newport Beach is known for overdone everything.
Not from my practice.
Not from your practice.
Right.
Why? Why not?
Because
and
I don't
why do you
agree
think
with
that's
it.
happening? Is it the surgeons? Is it the people?
I think it's a little bit of both. I think some people think that that's beautiful to have bigger breasts, bigger lips, bigger hair. I don't know. I think there's sort of a trend though for women picking smaller, more natural results now. I'm seeing a way bigger trend in that. But again, I attract people who tend to want to be a little more natural. So I'm not sure if it's my trend or it really is a trend. But I'm hearing of women coming in and getting smaller breast implants.
Who's the ideal mommy makeover patient? Describe the scenario and why she's ideal.
Somebody who's had a couple kids, or it doesn't matter how many kids, but they're done having children. They're at their ideal weight. They exercise, and they're just trying to get back to pre-pregnancy size. They're realistic. I want realistic patients who aren't expecting miracles. But it really can boost somebody's self-esteem. So somebody who's just looking to get that edge back.
Okay, good. I want to thank you for coming on the show. Very interesting. And we're out of time, but one of the things that I said, I want to ask you questions about the medical school process. I mean, when did you know you wanted to be a plastic surgeon?
I knew from a pretty young age I wanted to be a doctor. Once I got exposed to plastic surgery in general is when I knew. So I grew up knowing some women who went through breast cancer. And their self-esteem was ruined at the end of all that. I wanted to be able to give women back what they deserve to have. And so
you were attracted initially by breast cancer patients?
Initially by breast cancer patients, yes. Okay. And then that led into the Mommy Makeover. That whole self-esteem thing is what I knew, that I had the artistic ability and the intellect to get through all of it. And I wanted to give women back what they deserve.
So you knew early on you had the intellect, you could do whatever you wanted.
Yeah, I felt like it.
And you knew you wanted to be a doctor, a medical doctor. So you were a freshman in college. I mean, when did you know?
I was pre-med right when I went to college.
So you knew you wanted to be plastic surgeon?
Not plastic then. I thought about it because of the whole breast cancer thing. But once I got exposed to it and saw that I could combine the science as well as the artistic side of my personality, it was a perfect fit.
Is it competitive for a woman? Is it harder for a woman in medical school?
It's definitely competitive. Right now in medical schools, it's about 50-50.
Okay.
But I think surgical fields are definitely more competitive for women. There's not as many women in the field. I think women think, oh, I want to have a family, I can't do this. Well, the first time somebody told me you couldn't do this was when I knew I would.
Meaning you couldn't have a family, couldn't have a couple of kids,
you can't
things
have
like
it
that,
all.
and be a plastic surgeon.
You can't
at the
be
same
a plastic surgeon and have a family. And I said,
and you've managed it.
Absolutely.
You seem to have fun in your practice. I see you on Facebook, and everybody's having fun. And they always say, that the goal is to have, if your life is half as fun as you appear to be on Facebook, then you're having a pretty good time.
Yeah, it's about balance. I dedicate my time to my patients, but I also have to dedicate my time to my family. It's, if I'm happy in both aspects of my life, it's a success.
What is your favorite procedure of all the procedures? If you had to say
a group of procedures, like Mommy Makeover is probably my favorite.
Your favorite?
Yeah.
Why?
All the reasons we talked about, the self-esteem, and it is so rewarding to see these women. They hug me, they bring me gifts because they are so happy, and they all wonder, why didn't I do this sooner? I mean, it's just such a great satisfaction.
What about the spouses? I've had a plastic surgeon on my show that said, Randy, oftentimes the men talk them out of it, don't want them to do it.
Because they think hopefully, that you look beautiful how you are, you don't need to do this. What they don't understand is the psychological aspects of that. The men are always on board afterwards because they see how happy their wives are.
Then talk to the men, men watching this, that don't want their spouse. Really?
Absolutely. They're going to be benefiting from it in the end.
Do you think the fear is for men, and I've talked to guys about this topic, that they don't want their spouse or partner, girlfriend, whatever, to look done?
Right.
To look like...
They don't have to look done.
Okay.
And so I think that is a big fear for men. And I also think sometimes men are like, well, I don't want other people looking at my wife. Well, if it's done naturally, they're both going to gain from that. The woman's going to have more self-esteem, so it affects their, their marriage as well, their sex life, everything. What
transformations do you see in your practice? You do the Mommy Makeover. I mean, I hear stories where people get a better job, they maybe get out of a bad relationship, or they start dating again, they become more active. Tell me about that. What do you see?
They improve their marriages because they feel better about themselves. I truly believe you feel better about yourself, you're going to be better in the workforce, you're going to be better with your spouse, you're better with your kids because you've gotten that lift. So I think it makes a huge difference.
Big difference. Okay. And final message to a woman watching this. She's afraid for whatever reason. Maybe people have a tough time doing nice things for themselves.
I think they do.
Okay. So what do you say to her?
You deserve it.
Okay. They deserve it. And they can call free consultation?
Absolutely.
At your practice?
Yes.
And do people travel ever to see you?
I have people from Oregon, Michigan, all over Southern California, Northern California.
Is that right? How did they hear about you? Search engine optimization?
Yeah, but I think some of it's word of mouth too. I have patients whose families live elsewhere, you know, then they have their families come out.
You do a lot of breast augmentation in Newport Beach?
I do, but you're not going to be able to tell. They're not. I'm not one of the ones that, you know, they're too big.
Really?
Yeah.
Okay, but you say it's the happiest group of patients. I don't want to put words in your mouth, but I think you said something like that. You like them because they're happy.
It's a happy group of patients. They're very easy to please because it's an instant result.
Is there that much technique though to breast augmentation?
Absolutely there is.
Really?
Yes. If you don't put the implant in right, you don't divide the muscle right, they're malpositioned. You know, you see women walking around with implants way up to their clavicles because it's done wrong.
Really?
Yes.
So the high breast, the high floating breast, that's just not a matter of the healing process for some people?
Either too big of an implant or it's done improperly.
So judgment of the surgeon maybe allowed the patient to talk them into a bigger implant?
Yeah, I think some surgeons go into it knowing that they're going to give somebody too big of an implant that it doesn't fit on their frame.
So the bigger implant is what makes it rise high?
Part of the reason, yes. Also placement. So if the pectoralis muscle runs not all the way down to the inframammary fold, that's where you want the implant. So if you don't divide those fibers properly, that muscle is going to hold the implant too high.
Where do you place your incisions?
Usually in the inframammary fold if it's not a lift patient.
Okay, now what about the plastic surgeons that like the nipple area? They say that it's easier to access, better pocket development, et cetera, et cetera.
The reason I don't like that one is, one, you're dividing women's breast tissue as well. You'd have to divide through the breast, which leaves a scar in the breast. I do a lot of breast reconstruction, so I'm always thinking about how I am changing the architecture of somebody's breast. There's also ducts. Ducts are dirty, so there's a higher incidence of capsular contracture and
that's hardening the breast?
Yes, and infection.
Through the nipple area?
Through the nipple area. It's you know, it's a small number higher, but it's something to think about.
But why,
it's a good place to hide a scar.
Why did these guys do it then?
It's a good place to hide a scar.
But
and women also ask for it.
They ask for the nipple area?
Yeah, and so I educate women why I like the scar where I put it, and most of the time they'll agree with me and say, okay.
But as far as the nipple area, and I want to go back to this, that because it's divided. I've had plastic surgeons that swear by the nipple area, and the other ones, Mo Zachary, plastic surgeon buddy of mine, says, Randy, if that's the most beautiful part of the breast, you don't want to risk scarring that area.
Right, because if you
go
get
in the fold.
Contracted scar and leave a dent, it's very hard to
fix. But then the other guys say, but Randy, no, he doesn't know how to do incisions. Because if you do it right, it's the perfect place to hide it.
Right, but there's a lot of reasons not to.
Okay, good.
In my opinion.
Is there any increased sensation when you do that area?
No, there shouldn't be.
Okay. Armpit. What about armpit and belly button? Going through that area? Because that's going on, right?
Right. I occasionally do an armpit, but I don't do a belly button. It's just too long of a distance from the belly button to the inframammary fold. You're making a tunnel through there. Your access isn't as good. The scar tissue, I won't even do that.
Is that still going on, by the way?
Most plastic surgeons won't. Yeah, but most plastic surgeons don't. It's usually the cosmetic surgeons that do.
The cosmetic guys. And do you think it's gimmicky? They're doing it...
Scarless surgery. There's a scar. It's
Scarless
in your belly
surgery. I interviewed a guy in San Diego. Wrong answer, you know, and nowadays we're in a position where we just don't interview anyone. And I said, why do you go through the belly button? And the worst answer, in my opinion, was, it's a niche, because nobody else is doing it.
Right. Doesn't mean
Wrong
it's good.
answer. It's not about the result for this guy. And so, so you think it's a gimmicky, and in the armpit?
It can be a good place to hide a scar. You know, some women don't want any scar on their breast, so they want it in the armpit. If I do it through there, then I use a scope so that I still have very good access.
Okay, over the muscle or under the muscle?
Under the muscle.
Always under the muscle?
Always under the muscle.
Never over the muscle?
I would never say never, but pretty much always under the muscle.
Interesting, interesting. Are there still a lot? I've met one guy that swears by only over the muscle.
Yeah. It can be a good result until it goes wrong. You know, the incidence of capsular contracture is significantly higher over the muscle.
Okay, and then and when women, and what are the frequently asked questions there, by the way, when they go in for breast augmentation, or a breast lift, I should say? What are they worried about? Aren't they worried about scarring?
They are worried about scarring. That's for a breast lift especially, because there are more scars than with an augmentation. With an augmentation, you can get away with a 4-centimeter scar in the crease of the breast nobody's ever going to see. If they have a lift, they've got one around the areola, one in the front of the breast, and one in the crease, but they all fade. So once you show them the pictures, what a before and an after looks like, I think the scars are a good trade-off because they do fade.
And you told me that, you know, aside from money or anything else, that the most rewarding, I want to make sure I have this right, the most rewarding procedure for you is like breast reconstruction.
Yes.
Elaborate on that.
Through the process of cancer, You know, women are losing a lot. You know, some women have to go through chemotherapy, radiation therapy. They're losing their breasts. So if I can give them back something, you know, a breast is something that women identify as being a woman, you know, and giving them back that self-esteem is the most rewarding thing I've ever done.
Okay, so a woman's had a mastectomy.
Mm-hmm.
And so this is your favorite. Do you think you have a knack for it, for making it look natural, things like that?
Yeah.
And what do you do to create the nipple area?
Some women, there's an increasing trend in doing what's called nipple-sparing mastectomies, where you can actually save the nipple. If we can't save the nipple, then you recreate it with a flap on the breast, and then I use a skin graft from the areola. So the after results, occasionally women actually look better after their breast reconstruction than they did beforehand. Yeah, if they had, you know, if they had long, droopy breasts, then afterwards they're going to have perky, higher breasts, so they actually look better. But, you know, it's not a good way to have to have it.
Is there a fear, though, after a mastectomy that the patient doesn't want to do any operation on that breast again because it may compromise their immune system, make the cancer come back? Is there any truth to that?
No.
Okay.
No. People used to have a fear of breast implants, but there's never been any proven studies showing that it contributes to autoimmune diseases or cancer or anything else. They're safe. Silicone gel implants are safe, and that's what's most typically used for breast reconstruction. Occasionally there's also flaps from your belly or your back that are used in breast reconstruction, but I would say the most common procedure that I do for breast reconstruction is implant-based.
What about a lean woman that is trying to do this after mastectomy? How do you do it? How do you have to
you put a tissue expander in first, so it looks similar to an implant except for it has a port in there that you're allowed to put fluid through, and so you expand that first. Women can be involved in the decision of how large they want to be.
Like a month prior to the surgery itself?
You do it at the time of mastectomy. So at the time of mastectomy, the breast is removed, tissue expander is placed under the muscle. Then they come into the office for several weeks to months after surgery, and you slowly fill that breast. So that it requires a second operation to remove the tissue expander and then put an implant back in.
Okay. Now, who normally does nationwide the reconstruction of the breast for these women that have had cancer mastectomies? So is it normally the plastic surgeon? Is it
the plastic surgeon?
But is it more so the medical person that works at the hospital, or I mean, because you're like a cosmetic plastic surgeon.
I do both.
Okay.
So some plastic surgeons choose only to do cosmetic surgery.
Okay.
There is a big portion of my practice that's also breast reconstruction. I don't do a lot of other reconstructive type procedures. I do some skin cancer reconstruction, but the main reconstructive portion of my practice is the breast reconstruction.
It's a very, and it's a tough time. So how soon after the mastectomy can they do this?
The tissue expander is put in conjunction at the same time of the mastectomy. So then about 3 months later, the tissue expander is removed and the implant's put in. That's on average.
So how soon after a mastectomy should they see you or get a consult?
They should see me before they have surgery. So at the time that they're diagnosed with cancer, the breast surgeon refers them to me as well. So we plan this all together. Breast reconstruction is started at the same time as the mastectomy. So the general surgeon comes in, does the mastectomy, then I come in and put a tissue expander underneath the muscle, and we start the breast reconstruction that day. They follow up in the office for several months getting expansions. So there's an initial amount of fluid put in the expander at the time of surgery, and then it gets bigger as we go. Once we've achieved full expansion, at about 3 months they have their second surgery, which is the removal of the tissue expander, placement of a silicone gel implant.
How do you get your referrals for those?
That's from the general surgeon. I have several referring physicians that send them to me, and that's also been from word of mouth. Patients are really happy with their reconstructive results, so then the general surgeons hear about it, so I have more referring to me.
Okay, good. I want to thank you for coming on the show. Very interesting. And final message, anything we didn't talk about? You drove over here, you knew that you were going to be interviewed. Anything we haven't talked about?
I think we covered pretty much.
All right, and they could go to your website. You have a beautiful website.
Thank
you have before and afters on that website.
Absolutely.
And well, pleasure having you on the show. We'll have to have you back.
Thank you very much.
You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you'd like to see this interview again online, visit our website at wellnesshour.com. You can see it on our YouTube channel and, of course, on her website. For now, I wish you good health.